breathing and relaxation, we will give you some tools to better manage life stressors.
You may be curious about why breathing is such an important part of stress management. When we are stressed, our nervous system is heightened. It becomes on high alert. As discussed in the stress chapter, when this happens, we often start to have more difficulty with managing our sleep, pain, mood, and many other things in our life. We cannot always control the cause of stress, but when we regulate how we respond to it, when we put our energy towards what we can control, we end up in a position to make better choices. We can go weeks without food, days without water, but only minutes without oxygen. As a result, the parts of our brain that are responsible for survival, those fight or flight responses we talked about in the previous chapter, is highly connected to our breathing. If our breathing stops, our brain only has a short amount of time to come up with a plan. In addition, our brain takes cues from our breathing about our level of safety. Keeping that in mind, we can use that to our advantage by changing our breathing patterns. We can send signals to influence our brain and our stress responses. Breathing will not make our stress disappear, but we can use it to cope more effectively and take back control of our stress responses. Who can benefit from breathing and relaxation? Anyone with acute or chronic stressors, difficulty with energy or sleep, a chronic illness, pain, difficulty regulating their mood, or anyone who wants to better quality of life. In short, everyone can benefit in some way by learning how to use breathing to calm their nervous system and improve their responses to stress. It may seem odd to think about learning how to breathe, but this is the first skill we learned when we were building relaxation skills. Breathing serves as a foundation for most other relaxation and mindfulness skills, and it is one thing that we can do anytime, anywhere, for free, and nobody even needs to know that we're doing it. That makes it a really powerful tool. We will focus on breathing in this chapter, but there are many other skills you can learn to improve the connection between your body and your mind, and to calm your nervous system. There are several different breathing strategies. We will teach you a few of them today. Try them out and see which feel the most comfortable and relaxing to you. Keep in mind that since this is likely different from how you breathe normally, it may feel a little odd. That is okay. If you are feeling dizzy or lightheaded, you may be breathing a little too slow. Work on finding a level that feels different, but not uncomfortable. And over time, you can continue to slow down your breathing and work on doing these exercises more often and for a longer period of time. To start out, it is often recommended that we practice breathing in through the nose and out through the mouth. You can help remember this by thinking, smell the roses, blow out the candle. Another strategy is called diaphragmatic or belly breathing. To learn this, you start by placing one hand on your belly and the other hand on your chest. Now take in a big, deep breath and let it out. Which hand moved more when you did this? Can't remember? Try it again. In and out. For many people, they will notice that they breathe up in their chest, causing that hand to move more. Other people find that both hands move, that they breathe a little with both their chest and their belly. Unless you have had this training before or learned how to breathe this way while learning to sing or play a musical instrument, you will likely not breathe entirely down into your belly. When we do this right, it feels like our belly is expanding outward like a balloon. You will likely need to practice this in order to have it come more naturally. Do not try to push out your stomach. Rather, focus on letting your stomach muscles relax while you let your lungs fill deeply. If you are able to, some people find it easier to practice this when they are lying down or supported in a chair, as it makes it easier to relax their stomach muscles. Shape breathing can be another strategy to help regulate our breathing. One example of this is called triangle breathing. For this tool, you breathe in, 2, 3, hold, 2, 3. Breathe out, 2, 3. Breathe in, 2, 3. Hold, 2, 3. Breathe out, 2, 3, and so on. Similar to this is square breathing. For the square, we breathe in, 2, 3, hold, 2, 3. Breathe out, 2, 3, hold, 2, 3. Breathe in, 2, 3, hold, 2, 3. Repeating this pattern over and over again. By putting in those pauses, we slow our breathing down. In addition, since this type of breathing is different from what our body is used to, it requires a certain amount of mental concentration. By focusing your mind on your breathing, you give even more power to the signals you are sending your nervous system to calm down. It also can help you quiet your thoughts and focus on something healthy during times of stress or anxiety. You will likely find that you have a favorite technique, one that feels the most comfortable to you. However, it is nice to have several options so that you can switch it up over time. Pursed lip breathing is another tool that is often taught to people to aid in overall relaxation or to address shortness of breath or conditions which affect breathing, such as COPD. For that strategy, you inhale slowly through your nose, keeping your mouth closed, while you count to 2. It is not necessary to take a deep breath. A normal breath will do. Then you pucker or purse your lips as if you are going to whistle, and you exhale slowly and gently through your pursed lips while counting to 4. When you put both steps together, it looks like this. Up to this point, we have focused on breathing, but there are many other skills and tools you can learn to build on top of your breathing skills that can help to manage stress, improve your health, and to provide relaxation both mentally and physically. For instance, you may notice that you carry tension in different muscles of your body. This tension can reduce blood flow, trigger headaches, change our movement patterns, and can send signals to our brain to keep our fight or flight response system on high. Our muscle tension is similar to breathing. Our brain controls both of these systems. However, if we start paying attention, then we can take over control if we want to. The more aware we become and the more proactive we can be about changing these patterns, the better it works. If we notice, for instance, that we tend to carry extra tension in our shoulders when we type on the computer, we can include regular stretching and relaxation during this activity before the tension builds up so much that it catches our attention and becomes painful. Progressive muscle relaxation is a strategy where you mentally travel through your body, tightening and relaxing various muscles as you go. This can be a tool that can help you to gain more insight and control over your tension. There are many other tools that use mental imagery, walking, art, dance, and other skills to help clear the mind to the present and work to redirect your energy away from stress and towards a healthier and more well-balanced internal state. There are classes you can take and other resources such as videos and books that can help you learn these techniques and apply them to your daily life. Making tools part of a regular routine is a very important part of this process. All too often, people use these skills in response to stress, anxiety, anger, or pain. In reality, these strategies are much more effective when we use them preventatively to take that baseline stress level and lower it down. When you do that, you have a longer fuse. You can tolerate more without your system becoming overwhelmed so that you can stay ahead of the stress instead of always having to react and respond and have the stress control your life. For the largest benefit, it is suggested to engage in at least 20 minutes of breathing or relaxation each day, in periods of at least 7 minutes each time. Work to find ways to build a routine and include this as part of your health plan and daily routine.